Let me put the fuzzy in the background. Kitty cat, what's up? Mason, you there yet?
Yep.
Right on, man. Good morning.
Good morning.
A lot easier just to roll out of bed and do this than to drive all the way to work in this.
Oh, I know. Yeah, it's pretty bad.
This is pretty bad. Well, it's the timing, right? I mean,
hmm
it's the timing. The heaviest part's right during travel time. So, and it's
hmm
much deeper than it was predicted already. We got 3 inches already out there, and it's supposed to snow another what, 14 or 8, 9 hours.
Yeah, I think we might get like six. Might get like
Right.
6 or 7, but we'll see.
Yeah. I mean, it's just a nice, steady, light to moderate snow. And the flakes are tiny. So they
hmm
like stack up quick. My cat's not happy. I'm sitting next to her on the couch. She's like, "This is my couch." Is your dog with you?
No, I can get him.
Nah, you don't need to. Sometimes, they hear you talking, they come around, right? Like, hey,
hmm
what you doing in here? Hopefully everybody will make it. We'll see.
Yeah, we'll see.
There's only going to be 3 board members.
Well, hopefully, all three of them are there.
I hope so. Can't have to have a quorum to have an officially sanctioned meeting.
hmm
I mean, I guess we could give them we could do all the reports and everything if it's just 2 of them, but they can't vote on anything.
Yeah,
They can receive information, but they can't vote. So hopefully all 3 of them will be there. So it'll be Brandon and Smith and Karen.
okay.
So that's who to expect. And also, I'm pretty sure that Caleb from the Spirit of Jefferson will be there, and so will Nathan Cochran and maybe Steve Grow. We'll see.
Let's see. Okay,
And then you know, there's no executive action. There's no executive um, sessions or anything like that. It's super duper basic.
that's good. Let's see.
And Jennifer Kraus, yes,
Yep,
she might be on. Yep, here she is.
yep, there she is. I was gonna say.
Excellent.
Um, let's see.
Everybody would make sure you look. I think they do a reminder when you join, right? It tells you it's recording. It told me so.
Yeah,
Make
it's recording.
sure everybody knows it's recording, so we don't get one of those silly Zoom errors where somebody's got like an avatar or they have something strange in their background, or their kids or dogs are running all over them.
Do we know an Amber Williams Taylor?
Well, it's a public meeting. Go ahead and let her in.
Yeah, we'll go ahead and see what happens.
We don't know her, but if she wants to be a part of it, maybe she has public comment. That's fine.
Alrighty, sounds good.
Good morning, Commissioner Kraus.
Morning, Gino. How are you today?
I'm doing very well. You're very red.
I I can't figure out how to get my name on the screen like everybody else's.
Oh,
Let's see.
yeah. It
I'm
identifies you.
Yeah,
Okay.
your name's on there.
Your name, it's just not coming up as the on the
Yeah.
big part, but at the
Right.
below part is good. Yeah, so there you go. Exactly.
That's a little
Enjoying the
better.
beautiful weather.
Oh, I love it. It's my favorite.
Mine too.
Absolutely my favorite. It's good stuff. And the kids are home from school. So,
That's nice. That's nice too.
yes.
Now you
I
don't
can't
have,
promise anything about what happens in the background here.
nah. You can
They
blur
do
it.
their best.
You can blur the background if you want. It's up to you.
Oh, no, I was just teasing about the kids in the other
Yeah.
room.
All right. It's a given when you do remote stuff like this. So either way,
Yeah.
this Board of Health, even though the county government's closed today and we're closed, this Board of Health meeting needs to take place. So we're
It was delayed last time.
yeah, it was delayed last week and we didn't have one
Yeah.
in December. This needs the Board of Health needs to know where we stand financially and all that right now. So it's important. Luckily, we're in a good place.
That's right.
So it's not
And
too
we'll see.
nerve-wracking then.
No, not too bad.
Yeah.
Well, I'm going to excuse myself for just a minute. It seems
Yep.
I have a few minutes before the meeting starts. Yes?
Indeed. Indeed.
All right. I'll be right back.
Mhm.
Okay.
Oh, that's Amber Amber from Cox Holiday Young. That's our accountant. It took me a
Okay.
split second. It's like, why don't I know this name? Why do I know this person? I know this person. Sorry, Amber.
Oh, sorry. I walked away for a second.
Yeah, I didn't realize it was you. I'd forgotten that you said you would be here. Well,
Yeah.
you would be online, let's say, not here.
Yep, I'm here. Well, you know.
I have my cat next to me. Hey, cat.
Mine are both, are they both sleep? Yes, they're both sleeping on my bed.
She she usually dominates the couch. So I'm sitting on the couch with her. She's kind of like, I'm not sure I like this.
Yep.
Everything's good. All right. I thought maybe you were somebody giving public comment. I was like, no, that doesn't seem right. Why do I know this name?
It's too early in the morning.
No, not yet. I was awake 2.5 hours ago, but AWT, that's the initials, right?
Yeah.
So in the Marine Corps, that's Advanced Warrior Training. So
Oh,
it's
good.
like there's BWT and then there's AWT. There's Basic Warrior Training and then there's Advanced Warrior Training. Kind of fun.
Didn't know that.
AWT. So we have Karen. That's good. Just need two more.
Yeah, I just had
Good
to
morning.
install my Zoom in my new computer and need
Nice.
to I need to fuzz out. I'm in my like craft room office area and it's not a great background.
Ha! I'm just getting all kinds of good news this morning. Just got another email. Look at this. What does this one say? Oh, it's the grants people. They just cleared one of I finally figured out how to process this grant invoice. And he said, "You did it perfect." So he's like, "Send me the rest of them and I'll process them all on Monday." I was like, "Thank God." So difficult sometimes.
Morning, Ann.
Good morning. How are you?
Good. How are you?
Good. It's beautiful outside.
It
I was
is.
out there. Gorgeous. Love
Are
it.
you at home or at the
But
office?
No, office is closed.
So I guess that means I can't come in and sign checks for Wendy today.
Yeah. We'll find you another time, Karen. Don't worry.
Okay. All right.
I'm not worried about it. There's nothing like, God, it has to be done like right now type checks. It's nothing like that.
Okay.
It's, yeah, we need them signed and processed and sent out, but nothing's like, oh my God, if it doesn't get out by Monday afternoon, we're screwed. It's nothing like that.
So Karen, I'm very sorry to hear about your dad. That was very quick, wasn't it?
Yeah, a little unexpected. I mean, he's 84, so you know that you're always kind of on borrowed time, but yeah, no, it was unexpected.
So how was your mom?
I mean, she's got Alzheimer's, so yeah, she's which is I mean, she's physically fine, but she doesn't walk, she doesn't talk, so
No, I'm sorry to hear that too.
yeah, so we had her at one of the visitations. Yeah, it was kind of weird because my brother asked her, like, "Do you want to go to the funeral?" And she's like, "Yes." It's like, "Oh, you said a word. Okay."
Okay.
But she didn't really understand what's happened.
You don't know. You don't know
Nope.
what they comprehend and what they don't. So
Right.
I think she had some understanding. But again, you just don't know what processes and what doesn't
Right.
for people in her condition.
Right.
And this has been several years of her in this condition, hasn't it?
Yeah, I mean, she went into memory care 4 years ago, actually, this month, and but she was diagnosed with this, gosh, probably 3 years before that, at least. Yeah, 3 years before that, and I think she was already starting to suffer from it well before that. So it's been a while.
I'm sorry to hear that.
Yeah, thank you.
Hugs to you, girl.
Thank you. But we put on a hell of a funeral for him, so that's
Well,
complete
good.
with polka music.
Good.
Nice. That's beautiful.
Yeah, I'll have to show you when we're in together again. We did the flower shop that did our flowers for the family and everything were just gorgeous. And they did a flower display using incorporating his button accordion.
Oh,
And it
wow.
was stunning. It was absolutely stunning. And people are like, is it like weird if I take a picture? I was like, no, please, like, take a picture and, you know, promote the local business and whatnot. So yeah, it was pretty cool.
Very
So
nice.
I hope you took some pictures.
I did of the flowers. Yeah.
That might be a neat piece of memorabilia for you to bring the accordion and have somebody like Jordan and Hess in Martinsburg recreate an arrangement for you to put on your dining room table or someplace at
yeah.
home to have a memento.
Yeah, that's kind of cool. Except I don't know if Mike would go with the accordion display.
Maybe if it's not being played, maybe.
Well, that's what he said, because I actually have my dad plays did play the button accordion, which I don't know how to play the button accordion. I know how to play the keyboard accordion. So I have my
Pretty
keyboard
cool.
accordion. One day I was like, I'd like to pull it out because I haven't played it since I was a teenager. He was like, no, he's like, I don't even like accordion music when somebody plays it well. And I'm like, thanks a lot. It's like, you don't know.
Look at Charlie. She has like her own home office and everything going on there. And she's thinking we can hear her, but we can't.
I am in the office.
You're in your office at work?
I am.
You're crazy.
I don't live too far away.
Okay, be safe, please.
Yeah. I will.
I know
So
you
how
drive a
much
Subaru
snow
though.
do you,
I
how
do.
much snow do you think we have, Charlie?
It looked like we had 3 or 4 inches at least.
Yeah,
Remember-
that's kind of what I'm thinking it looks like here too, but I haven't been out the door yet.
Remember, we have a meteorologist on staff.
Uh,
So you can ask him
That's
any questions.
That's
All
what we're on pace to probably get 3 or 4 more, maybe.
Oh, wow.
Really?
Mhm.
Really?
But we'll see.
Yeah, I didn't drive my Impreza Sport. I had my husband's Outback today.
Good move.
Smart.
That's so funny
Right.
how this. Good morning, everyone.
morning,
So
Brandon.
funny how the disclaimer is. Well, you drive a Subaru, so it's like okay.
Yeah,
you
it's
drive a
okay.
Get to work.
Subaru. That's
There's a
awesome.
chance after this I'll be going back to the house. We'll
You
see.
don't need to get snowed into the office,
No, I live here enough as is.
right? Exactly. All right. Well, I think we're 1 minute after 9 o'clock per the clock. So we will get this party started. Oh, and I thought I had hold on. I thought I had my agenda up, but I somehow lost it. So I'll call the meeting to order. And we can, oh, there we go. We'll get started on the agenda. So any changes to the agenda? Okay. Moving on to the minutes. Anybody have a motion to approve the minutes?
I move we approve the minutes as written.
I second.
Right? Any discussion?
Good.
All those in favor say aye.
Aye.
All right. Meeting minutes pass. Anybody online for public comment period? Gina?
I didn't see anyone. Mason, do we see anybody?
Let's see.
Anybody wanting to get in who's not in yet?
I don't see anybody.
Okay.
Okay. So if
Okay.
no public comment, we'll move on to, we don't have any unfinished business, but we have a lot of new business, which we'll start with Charlie and the financials.
Good morning, everyone. Nice to see you virtually on the snowy day. As a reminder, today we have the October final budget financial packet, and then we have preliminary for November and December. So start out with October.
So I'm
we-
sorry. So for clarification, so we're only doing preliminary for November. We're not doing finals for November.
Yes, since you haven't seen the November packet yet.
Okay.
Right. You
Um,
haven't seen a preliminary version of it yet of November.
Okay.
So my mistake. I should have labeled that as October or November and December preliminary. My mistake.
Got it. No worries. Okay.
I apologize.
All right. October 31st of 2023, we are 33% through the fiscal year. Bank balance of $557,000. We're in compliance with reserve requirements in excess of $177,000. Looking at the financial summary, October, just looking at the month alone, we had revenue of almost $69,000, salaries and wages of $84,000, and then operating expenses of $20,000, leaving us a deficit for October of $36,000. Looking at the fiscal year to date, revenue $403,000. We're going to reduce that by salaries and wages of $386,000 and operating expenses of $99,000, leaving us a deficit through October of $82,000. And as we've discussed in the past, we're kind of cyclical, so that's not really surprising at this point of the year. This is going to be a little bit of a trend as we go into November. December is going to look a little bit better, but we'll continue to discuss that throughout the packets. I'd also like to point out, if you compare to last year, we're only at a $200 difference between where we were last year at this time and now. So we're on the same track. Accounts receivable, we're at $238,000, and almost 155 of that is West Virginia Treasury. Everything else is below that $10,000 or 10% threshold. As far as where we are compared to the budget revenue, we're 6% below what we budgeted. Salaries and wages were a little bit more than what we budgeted by 1.3%, and operating expenses, again, we're a little bit above at 1%. But really, I would consider that on track for the year. Any questions on the October financial reports?
Just want to state it's pretty awesome that 4 months into the operating fiscal year, you're only $250 off of last year's performance. That's pretty cool. Is that
Agreed.
is that somewhat of a coincidence, or is that just kind of all stars aligning on revenue and expenses?
The second.
All stars aligning and Gino doing a heck of a job.
I would say luck. Let's call it luck.
How's the revenue? I'm trying to get to that page in the packet, but 4 months in, like, what's the revenue difference year over year?
Oh, so that's gonna be on the last page.
Yep.
So the revenue
Yeah,
difference.
I think page 20 in the packet.
We're looking through, and you want to look through October, correct?
Correct.
So the revenue difference is about $66,000.
60,000 more this year than last year.
$66,000 more, so 20% higher than last year.
Okay. So revenue up 20% over last year.
Yep, and then our salaries are a little higher too because we're fully
Nearly
staffed,
fully
right?
staffed. Nearly fully.
Fully. Okay.
More staff than it's been since I've been here.
Got it.
And so that means our operating expenses to date are a little lower than last year, and as of October.
All right, that's helpful. Thank you so much.
Oh yeah, you're welcome.
And again, yeah, I agree with Anne. Great job, Gina.
There's a team. It's not just me.
Yep, great job, team.
Gino
So
keeps
I
a
think-
close eye on it.
As he should. He's doing a great job. Do we have a motion to approve the October financials?
I move we approve the October financials.
A second.
All right, any discussion? All those in favor say aye.
Aye.
No opposed. It passes.
All right, I'll go ahead and move on to November. We're almost 42% through the year as of November 30th of 2023. as we look at the November and we look at the December, we're gonna see the bank balances going down. So we're spending our money, but we're kind of waiting for it to come in at this point. So our bank balance is $423,000. We're still in compliance with the reserve requirements by $42,000. We're gonna see that jumping down to the financial summary, we are at a deficit for the month of November of almost $90,000. Revenue was $58,000, salaries and wages $128,000, and operating expenses of $20,000. Giving us that deficit for the month of November of almost $90,000. Fiscal year to date, revenue $461,000. We're gonna reduce that by salaries and wages of $514,000 and operating expenses of $119,000, leaving us a deficit through 11/30/2023 of $172,000. So how does this compare to what we've actually budgeted? Revenue, we're 10% below budget. Salaries and wages are above budget by 5%, and operating expenses by 4%. Accounts receivable holding pretty steady, $274,000 as of November 30th, and 167 of that relates to West Virginia Treasury. One thing that I really would like to point out, so yeah, right now revenue is below budget, but clinical services, we're at 70% of what we budgeted as of November, but we're only 40% through the year. I just think that's fantastic. So really where we're lacking as of November is in like some of the funding.
Grant
Funding, yes. And then also permits and stuff that we'll see later in the fiscal year in the spring. Any questions on the November?
That was the month that made me freak out. December was is a lot better.
Yeah, December is a lot better. The cash balance is a little lower, but
That's okay.
we've sent out invoices and we're just waiting payment at this point. So
yeah, November was the one that made me freak out. I was like, I can see that, but I have to remember that this is cyclical, and this November, December, January, February are always the tightest months.
Yep.
Well, it looks like
if
through
you-
November, almost $100,000 more revenue than previous fiscal year,
Correct.
and only $7,000 off last year's fiscal performance through
Yep.
November.
But I saw
Yeah,
that. I noticed that difference.
very
I
comparable.
was like, So always try
That's
to
gotta,
always
yeah,
try to
that's
perform
gotta
better
happen.
every year, right? Every year you try to get better and better. So
and you're saying that a lot of the increase in revenue is the clinical revenue services?
yes, so when we get to the nurse director report for the activity report, she'll highlight some of the reasons why that we've been able to drive revenue on the clinical side. So
I can't wait to hear about
So
it. Thank you.
clinical side, we're $60,000 above last year.
yep,
So as of November of 2022, on the clinical side, we had revenue of almost $61,000. And as of November of 2023, we're at $121,000.
yep. Kudos to the nurses. Kudos to Dr. Reedy for making a good financial decision, investing early in some of the vaccines that have been most in demand early in the season. That's when I'm sure Brandon saw that when we were, our vaccine cost was quite high at the beginning of the fiscal year. And what we were doing was we were stockpiling for the winter, and we've now moved a lot of that stockpile. So
Great.
Do you want me to move on to December?
I don't have
Yes,
any other
please.
questions on November.
Oh, sorry, Brandon.
No,
Oh
that's
yeah,
okay.
sorry, Brandon. Thank you. All right, so December 31st of 2023, we're 50% through the fiscal year. We have a bank balance of $399,000. We are still in compliance with the reserve requirements by $31,000, almost $32,000. So you're gonna see December is a much better month. Revenue, $276,000, and again, that's December alone. We're gonna reduce that by salaries and wages of $13,000. So I would like to note this as well. There looks like there's a timing difference. So last month we had $123,000 in salaries and wages and 13,000. So it looks like there's just a timing of when that payroll hit the P&L.
Yep.
Then operating expenses, we have $32,000. Giving us a surplus for the month of December of $231,000. Fiscal year to date, revenue, $738,000. Salary, we're gonna reduce that by salaries and wages of $528,000 and operating expenses of $151,000, giving us a surplus through December 31st of $59,000. Revenue is on target, where we're now very comparable to our budget. Salaries and wages, we are on track, and same thing with operating expenses. Accounts receivable, $516,000, and almost $400,000 of that is West Virginia Treasury.
Let me give you a quick reason why that number is so high is because a lot of the billing for different programs, the first quarter was actually from was October, November, December, or August, September, October. So we just started billing those in December, and that's why you're getting that huge amount of revenue coming in, or potentially coming in, hopefully coming in. It's from the state, so it'll come in eventually. But that's the reason why we were able to bill out a couple big grants in the month of December.
All right, any other questions? for
The
Charlie?
only other thing I'd like to point out is compared to prior year. So right now we're at $59,000 through December. Last year, we had a deficit of $182,000.
And
Definitely better.
that's all timing on state aid and stuff like that, though. So
Okay.
I think we're pretty much in line.
Great. Any questions for Charlie on the December preliminary? Okay.
Thank you, Charlie.
Yep,
Thank you guys.
Charlie.
Thanks, Amber, Charlie.
I hope you guys have a great day.
You too.
You too, drive safe.
Yeah,
Will
be
do.
careful. All right, Gino.
Agency
Sorry, I'm pulling
activity
up my-
report.
Yep, pulling it back up to my agenda. Just can't scroll fast enough.
Oh yeah, hold on.
He'll pop it back up.
Yeah, I'll pop it back up here.
It's okay. I've got it. So I've got it. Environmental activity report, please.
Hi. So our numbers, you guys should have 2 activity reports there. For November was a total of 139 inspections, and in December, a total of 104 inspections. We have been awarded an additional $49,625 in grant funding for this calendar year 2024 in environmental health grants from National Environmental Health Association. And that's in addition to the $76,000 for this year that we were previously awarded. I have billed grants from last year and also the advance payment for the $76,000 for this year. In total, I've billed $101,500, and that should hit the bank soon. We we're not quite fully staffed right now because although Mason is our new sanitarian, he is already in training. We did lose one of our office staff, so the environmental resources position. So we're currently advertising for that position to replace it. I think that is,
So are we talking Mason? Our Mason is becoming a sanitarian?
yes.
Yes.
Oh, very cool. Awesome.
So yeah.
They don't have cool
Oh.
locations for conferences, Mason, like they do in threat preparedness.
True.
I
That's
know.
true. Although
He knows.
I have been to Denver and I've been to Nashville for conferences, so not too bad.
Not bad, not bad.
This year it's in Pittsburgh though, so
No way.
Oh.
Cool.
Great food, great food.
so. But that's all I have for the activity report. Did you have any questions?
Any questions?
No questions here.
All
No
right.
question.
All
Thank
right,
you,
we'll move on to
Jillian.
threat
Can we move on to
preparedness.
November's report or December's report?
Oh, sorry.
And
What's
highlight
that?
Jillian,
anything.
would you mention the grants for the other counties that have?
So, yeah, one of the grants that we were awarded for this year was a $20,000 special project grant because we have, in collaboration with the state health department as well as Monongalia Health Department, who's been involved in the program standards for the last few years. We created what we're calling the West Virginia Retail Program Standards Collaborative, and we have enlisted an additional 11 counties that have applied for grant funding and will be working on the program standards, and we will be mentoring them in that with the Monongalia and the state health department. We'll all be mentoring the 11 counties that we've added onto the retail program standards, and they all got grant funding, so it's successful already, and that's what will be one of the things that we'll be working on this year with grants. So
Give a quick thumbnail of the retail food safety standards that you're doing. What does it entail? Just quickly for people who may not know.
So it's basically a way to make sure there's a standard for the inspectors doing retail food safety inspections and a standard for the way that they're training, a way that they're keeping reports, their policies and everything else. It's just it's meeting the national standard for our food safety program. So we're trying to get everybody on board with doing risk-based inspections here in West Virginia. So that's one of the goals of this collaborative, because that's one of the goals of the standards. So.
And that you and your team are spearheading it throughout the state.
Mhm.
So once
And
again,
this will cover what percentage of the population of the state?
Oh my goodness, I don't have that number on me, but it's a significant, it's most of the percentage, but I don't have the number with me. We do have that in one of our presentations, so, but I don't know it offhand. So we'll also be presenting on this at a couple different, at a virtual conference and at the national conference this year, so.
very cool.
Good
That's very
job, Gil.
cool. Yep. That is awesome stuff.
Anything in particular on the December activity report for environmental?
No, I gave the numbers for it, but so I did November and December together.
Okay,
Yeah.
that made sense. I was like 143. That's not what it says here.
No, yeah, no. So,
Got it.
yeah.
All right.
All right, on to Mason.
So I'm, as mentioned, like I'm getting ready to transition over to the sanitarian position. So in November, I had my conference in Long Beach, and in December, it was more about doing a couple trainings, going to a couple meetings, but just getting ready and starting on that new position. And so I don't really have anything major.
Do we have Mason's replacement position out
So
on
there
in the
there are
market?
there are 4 applicants currently from what I've seen on the NeoGov on the Division of Personnel website. 4 applicants so far, and it's will be open for another like 7 days. And we will fill that. From what I know, there's at least one who's more than qualified.
Awesome. Great.
Yep, yep. Can't wait to have a new person in the office. It's always fun to have new people.
Mhm.
And I love that Mason's found an opportunity to move up
Yep.
in the agency and expand his skill set and
Yep.
whatnot. So
Never
congrats, Mason.
never deny anybody an opportunity if they think they'll be more fulfilled in a different position, right?
Right. Absolutely. Yep. Thank you very much.
You don't have to thank me. Just do a good job.
Yep.
All right. So clinical.
And so, Lindsay,
Good morning, everyone. So for November's clinical activity report, for family planning, we had 36. Compared to last month, it's pretty much the same. Breast and cervical cancer screening program, 1 sexually transmitted infections. We've had 8 and 3 encounters. Vaccinations is where our numbers are. 225, it has gone down from the previous month, which is expected as we go through the winter months. It keeps coming down, although it is a good number compared to last year. And in TB, we had 12 skin tests and others were 10. For the December activity report, as you can see, the family planning went up a few. Breast and cervical cancer screening program, we had 5. Sexual transmitted infections, we had 7 and 4, which is staying the same with the previous month. And vaccinations, a bit of a drop again. Again, as the months are going by, we start seeing drop, especially in flu and COVID vaccines. And school vaccines also are going down just because of the time of the year. But again, we're actually doing pretty well compared to previous years. To answer one of the questions earlier, we're doing really well. One of the reasons is because we're doing a lot more outreach. We are reaching out more into the community on several fronts, and that has helped bring more people in. We're also, I know right in here, the family planning looks the same through the months, but we do have our nurse practitioner, Leah. More and more patients are coming through. Having a on staff translator, Thais, has helped tremendously with reaching out to the Hispanic population. And it really does make a difference having a staff member being able to interpret on time with our patient in the room. And I've worked in the hospital settings where we've used iPads and electronic devices to reach interpreters, and there's a huge time delay. There's not that it's not a good thing, it's definitely a good thing. It's just there's a time delay that can affect clinical care, and having an on-staff person for this has been tremendous. Even in our outreach programs, that has been a big influence, I believe, in getting the smaller minority communities to come into our office. And being able to talk with parents of children when there's a language barrier. So those have all impacted a lot with our vaccine administration. And then Dr. Reedy also picking up more travel vaccines, and I guess he can talk more about what he's been doing, has all contributed to the increase in vaccine administration. So that's predominantly that reflects in our revenue as well.
Yep.
Our QRT program is doing well. Katie Blunt, as she's been working very hard. We're getting more and more phone calls. We're getting more requests through contact or messaging through Facebook. We are going out to the outreach events. We've been doing a good job. Stephanie Stout is also a part of our staff who's helping out. And Currently, our numbers look good. In the last fiscal year, we only started this in September, but within the 4 months that we were doing, by the end of December, we saw we were able to place 3 people into MAP program, the medication assisted treatment program. 2 people were in a 28-day recovery program, and 2 had graduated and were in sober living by the end of December. And those are good numbers to happen within just 4 months. Any questions?
Unfortunately, that demonstrates the need.
Yes.
Okay.
Thank you.
No, thank you, Lindsay. We're going to move
Lindsay?
on to Dr. Reedy.
Okay, Lindsay, before you disappear, I get a chance to brag on you also. So in public health, we talk about think globally, act locally, but it also goes back to acting globally. Can you tell us about your other sideline, your new appointment?
Oh, okay. So I am also a forensic nurse. I've been working as a forensic nurse since 2017. I work for both Jefferson and Berkeley hospitals. And the last year, I've been putting a little bit more effort into advocacy and being present at the Capitol, both Charleston and Washington, D.C. And in light of that, the International Association for Forensic Nurses reached out to me and asked me to be a board member, and I have accepted that position. And it's a really good thing to happen. I'm very happy that it has. I'm very grateful for the invitation. So I will be working as a board member, and I've never been a board member before, so this is a great opportunity for me. And yes.
Wow.
Can you briefly describe what a forensic nurse is in case someone doesn't know?
Yes, a forensic nurse. So forensic nurse, it can be broad. They basically are functions involved attending to sexual assault victims, both child and adults. We have the training to intervene with domestic violence, strangulation. Some forensic nurses also become medical examiners. Forensic nurses also work in prisons with prison population. So that's the large umbrella. In West Virginia, forensic nurses can only do sexual assault care. So our nurses are trained to do sexual assault only for care for children and adults. WVU has most of the same nurses, but there are other ones in the state as well. So what I would do is I'm on call 24 hours a month for Jefferson and Berkeley hospitals. And if a case walks into the ER, I will go in. If I'm on call, they'll call me. I go in and see the patient. I care for their needs as a nurse. And then I also collect any evidence if they want to open a sexual assault kit. And I do photography, all of their wounds and everything. And then as a forensic nurse, I wrap up everything, the evidence kit, and hand it over to law enforcement. And what needs to be sent to laboratories will be sent there as well. And the patients are put in contact with our community advocates. So some of the organizations, one of them is EPIC. So that's pretty much our role, is to care for a patient when they walk through the ER door and get them the resources they need to move on.
Wow, congratulations with your appointment. It's amazing.
Thank you.
Okay, Dr. Reedy.
Okay, so you've heard about that we're doing a lot of services, and that's not me, it's the staff doing it. The continuity, having stable staff for years makes a huge difference in that you're not having to retrain and reinvent every 2 months. And we're expanding the number of programs, having our new, relatively new nurse practitioner for family planning has been helpful. Hopefully, within the next month or two, she'll be approved for private insurances to be able to provide services. There is throughout primary care, there is a shortage of practitioners, and where we can step in not all of primary care by any means, but certain areas, the health department traditionally gets involved in, and gynecologic care, both breast and cervical cancer screening and family planning are traditional things, and the staff that does that's very enthusiastic, and we're continuing to see sexually transmitted infections, and one of the things initiated by nurses with my full support and involvement is those who are identified in the interview as being at high risk for subsequent infections, including HIV. We're talking about treating them with medications to try and prevent HIV if they come in contact. And we have a small number of people doing that, but it has created a lot of interest from some other health departments in trying to do it. It's small steps, but we are trying to be involved with our colleagues in the state. The hepatitis C treatment. So West Virginia's has for many years had the highest rates of hepatitis B and hepatitis C in the nation. And compared to 10, 15 years ago, hepatitis C treatment is phenomenally effective. It used to be shots that made you feel awful and worked in, at best, 20% of the people as far as getting rid of the disease. Now there are pills that have relatively few, if any, side effects for most people. It's 3 months of treatment, and over 95% of the people get cured. And the trouble is, most private practitioners or most general practitioners won't do this. The few who do it are so backed up. So we're starting to do that now, and it intersects very much with the substance use people we see, similar populations, similar issues. So those will be very time intensive. The pills for the 3 months are probably $30,000 or more. It's come down quite a bit from what it used to be, but it's expensive treatment. But this hopefully will prevent deaths from cirrhosis, which become very expensive also. We had a good event in December, reaching out with a local marketing firm, and had they call it a Feliz Navidad event, and it's like a little gathering, and it was primarily to provide information to the Hispanic population about services available at the health department. We had tables set up, I think 5 different sections, but also the school system's English with a second language and adult education staff were there. And then community markets, which is a farm to underserved people, food distribution agency got involved, and there were 60 to 100 people. They gave out over 100 food baskets, fresh food. I think the English as second language got 25 new participants signed up that night. So it was a first step, and hopefully we can do this again a couple of times a year and get even more partners involved. The Hispanic population's a really important population that a lot of the people do not know where to get services. And so we want to continue to reach out.
Great.
Any
questions?
So, yeah. Bevan had put together some slides about the respiratory viruses, but I'm not going to show that because it gives a lot of charts. But the main thing is this time of year we're seeing RSV, flu, and COVID. Fortunately, hospitalization rates from all of those are staying, moderate to low. We are still not seeing a surge in hospitalizations, even with all the COVID cases. So we're continuing to plug along, watching that. We continue to worry about other illnesses that show up, the measles cases here and there, and in England, and now Philadelphia. And a couple of travelers just got off the airplane in Dulles that were identified a couple of days later as having measles. So that's something that's largely not been a problem for the last couple decades, but vaccination rates are going down, and that's a concern because some people will have bad effects from this. So, no.
Thank you. Thank
Thank you,
Gino,
Dr.
you're
Reedy.
So I always have notes for myself, but everybody's covered all my fun anyway. So I'll just reiterate what has already been stated. One, we are nearly fully staffed. 2 full-time permanent openings remaining. I think we had 5 or 4 when I first started, so we've slowly been able to fill those and retain staff, which has been great. It's the threat prep coordinator and then the environmental side office assistant positions are both will be both available and open. Threat prep coordinator, if you have any friends, you can go right on the DOP website and they can apply. The environmental side office assistant position will be probably another 6 to 7 days or so before we're able to advertise for that. The DOP has some certain rules when you move staff internally, whether or not you can, until the official move of that official internal move has been done, you can't advertise a position as open. So we'll have to finish sliding one of our staff members into that position before we can advertise her position. So, and then the big one here, so from September 2023 to November 2023, the QRT, the Quick Response Team program, incurred a cost of about little over $58,000, and which I had just billed and wasn't able to bill until December. So when you saw that salary and wages jump in October and November, a lot of that's related to the QRT program, and we will be able to recoup all those costs with the grant. So there's more than enough money to cover the expenses in that grant that we've incurred so far, and I billed it in December, so we're good to go there.
great. Thanks for that clarification.
Yep. So other than that, the finances are a little bit better than I had anticipated. Like I said, I had a little bit of a meltdown in November when I saw that we were starting to get close to the reserve amount. But the fact that the clinical side is producing so much revenue and that the environmental side is also beginning to produce a lot of the revenue that they do in the second half of the year, the second half of the fiscal year, that's started hitting the books, and that will continue to hit the books throughout January and February and certainly in March. So financially, we're in a much better spot than I had worried about, so that makes me a little happier.
Us too.
Yeah, of course. But I
All
don't have
right.
anything else.
Okay. Any questions for Gino?
Good job,
None
all.
here.
Yep. Give this team some credit. They're working hard and in many cases working over expectations. So more than impressed.
Great job, team.
Yes, agreed. All right, if no other questions, next meeting is scheduled for February 9th. Hopefully it'll be snow less. Not less snow, but snow less. I always look at March 1st as my goal to get to. That gets us kind of out of the strike zone with these storms. So this is not really a storm, it's just snow. But we're almost there, folks. But anyways, February 9th, and we'll see everybody then. And is there a motion to adjourn the meeting?
I move we adjourn.
I second.
All right, those in favor say aye. Aye.
Bye.
All right, thanks. Meeting is adjourned. Thank you, everybody.
Thank
Bye,
you.
everybody. Thank you.
Bye.
See you next month.
Indeed.